Hello, and thank you so much for joining us today for the webinar Direct Anterior Layering with Composite and Clinical Guidelines. It is a great pleasure to introduce to you Dr. Serhat Köken, whose aim during this presentation will be to discuss how the rapid innovation of composite material in the last decade and the availability of various types of composites has given today's clinician a very convenient and cost-effective tool for their practice. Dr. Köken graduated from Marmara School of Dentistry in 1998. Since 2001, he has been practicing general dentistry at his private clinic in Istanbul. Over the years, Dr. Köken focused on direct composite resin applications and dental photography, and presented at national meetings on both the technical and artistic aspects of anterior direct resin restorations. He has also given several local hands-on courses on composite resin artistry. Serhat Köken is a co-founder of Instant Composite and Turquoise Study Club, and is an active member of the Turkish Academy of Aesthetic Dentistry and Chalkidon Advanced Dental Study Group. We'd like to thank Dr. Köken for being with us today and DT Study Club for making this lecture possible. Please take note of any questions and comments you have during the lecture, as they will be addressed by Dr. Köken at the end of the presentation. Without any further delay, please help me welcome the expert himself, Dr. Serhat Köken.
Hello, welcome to my webinar. I'd like to say good evening to as Javier Tapa did last lecture. Good evening to Asia, good afternoon Europe, and good morning to America. And I'm talking to you from Istanbul, Turkey. And this will be a lecture about anterior composite restorations and color perception. And I'd like to talk about planning my composite restorations. I'd like to talk about layering. I'd like to talk about finishing and polishing these composite restorations. To have some, we might have problems while we are doing especially composite in anterior region, and we have some guidelines with me and my friends, and I'm generally using these guidelines. Today I'd like to show you my guidelines with you, and here you'll see the topics here. These clinical guidelines for color perception are really useful in my daily practice, because they are just 5 in number. And the first one is morphology. So what I want to say about morphology is morphology is the most essential thing while doing anterior restorations, not only composite, for any type of anterior restorations, but I define it and I visualize it better with my photography. And to have better photography is not only enough, I need to know lots of things about illumination. Here you'll see some slides just telling about photography and illumination. But first of all, I would like to show you this slide. This is very interesting for me. I've seen the first photo ever taken by a human being on internet, and here you see it's from 1826, very earlier, but it took only 7 hours to have it. But today in our clinic work, we can have a digital photograph even less than a second. So this is my first photo, one of my first photos digitally in my clinic in 2005, and you see one of my last photos in 2015. You see there's a huge difference even in my photography. So I'd like to show about some secrets, or these are not the secrets, but they should be known by clinicians to have good photos. If you want to have a good photo like this, I think we should use a macro lens. But basically, having a micro lens may cause some problems, because when we want to increase depth of field, we need to have a good illumination as well. So basically, we have 2 types of illumination device. One is called ring, and the other is named twin. Ring, as you see, is a 2 type. The flashes are located very closely to lens, but on twin, it's easy to separate them, and you can move them away from lens, and you can have different angulations in different directions, so that makes our photography better. So you will see a clinical example of ring and twin flash difference. And here you see on the left part a ring example showing really because of the placement of the flash units very close to lens. So you see a very strong reflection over centrals and lateral incisors that will make a problem to visualize this texture of it. But on the twin one, you see the reflection is even less than it, and the line angles are visualized better. And what else? We can evaluate the texture, and even on the gingival tissue, here you see, these tissues can be examined better. So another clinical example. This is the same two upper right and left central incisors, and here you see left one is ring again and the right one is twin. I want to point out that the reflection area again on the upper left one, and even there is a restoration on the ring one and the twin one. It looks better on the twin image, but line angles are visualized better. That's a trick that why the clinicians are choosing twin in anterior region. Even the same restoration looks better with the twin illumination. Another example with the ring flash that we can use for shade selection for ceramic restorations. And it's a good way to have a dialogue with laboratory. To make it better, we can sometimes use cross polarization. We can use some polarization filters to have a different image than the original one. In this case, if we use cross polarization system, we can have a better we can have better photos in means of having less reflection area on the anterior region. Here you see on the right image the incisal halo, the texture, not the texture, sorry, the tissue underneath the enamel can be visualized without can be visualized easily by elimination of these reflections on the surface. But I will show you another picture. It can be used again for shade selection and composite button try technique. They can be even used. And here you'll see my way that I don't use these cross polarization filters to have shade selection. In composite, anterior composite restorations, my way to have correct shades is composite button try. Mostly more than 90% of my case are done with this way, but I use not ring flash. I generally, maybe always, I use twin flash to have the correct shade. So I will just show you a little, but in the later of this lecture, I will tell you more about it. Here you see what I do with this photography to have the chroma, to select the chroma coming from dentin. I increase saturation and decrease brightness. And what I do to have the correct shade for enamel, just black and white to see the value there. So what happens clinically? Here you see the desired shade is applied, and then we can have a beautiful, nice, natural looking restoration. What other thing that we can do with the photography is to have a texture showing photo. Here I use just a single flash. In fact, it's only one unit of twin flash. The other is not working. Just having it facing towards the lens and having an image like this is not that difficult, but it works easily. But the angulation is the most important of this technique. Once you start it, you will be able to have a photo like this very easily. And here you see another example of single flash again. And what I've done here, a mesio-incisal restoration on upper right one, showing 1 year recall and showing the marginal integrity of the restoration, or again in the mesio-incisal angle of the upper right one. And it's really useful to have a texture, to view the texture. And these texture photos are showing us the marginal integrity of the restorations. And of course, we know the opalescence feature of the tooth structure and the composite restorations. Photography can even visualize them. And another example that's showing the placement of the flash, and by this way, just moving them away from the lens and having, it's not that difficult to have a surface texture showing the perichromatas and the incisal structures, because it's a new emerging tooth. And we can evaluate the translucency, we can evaluate the incisal halo. Maybe we need a little bit software, a good photo editing program to visualize these areas. I will show you some other clinical examples showing how we can use photography to visualize better. This is one sample, and here you see another patient showing some texture on the anterior incisors. And here is one 3-month recall of a composite restoration showing the marginal integrity, showing the line angles, ridges and grooves, and we can have lots of data. This is a restoration after 3 months. This photo is taken, as I told you earlier, 3 months later. So we can have various photos like this in our clinic by using single flash illumination. So morphology is really essential to have good restoration, but we need to find out some spatial features of the tooth structure. If we keep them in our mind from initial to the final finishing process, we can create our beautiful restorations. What are the important points that we need to be careful to define earlier? Are outlines, long axis, and location of contact points, zenith points, line angles, incisal embrasures, and emergence profile, and etc. As you see here are the most important ones. But also we shouldn't forget to have information about facial planes, while especially central incisals are not flat, do not have a flat surface. They have curvature on it. And also one other thing that I want to mention here is the morphology is not based on single tooth structure, but we should have harmony, and this harmony can be better visualized earlier with photography, and after restoration they should be kept in our minds. And what else? The incisal embrasures should be carefully imagined and should be carefully prepared after the restorations. So secondly, the topics are chroma and value, and what we understand from, what I understand and what we must understand from chroma and value. As we know, municipal color system or municipal color space, hue is main color, chroma is saturation of that color. Hue can be something like green, yellow, blue, pink, any color, but chroma is saturation of these any color. For example, saturation of blue, saturation of pink, And the values of this is the hardest issue to talk about. It's brightness or whiteness of color. But I will try to explain you in the next slides. Here you see chroma. What here I could tell is, I think there's a white paint or milk. We start dropping some red paints on it. When we increase the amount of paint, it means that the chroma is increasing. So chroma is saturation of color. With every drop of red paint, the chroma is increasing. And what is value? Value is brightness or whiteness of color. It's very easy to tell, but not easy to explain with dental structures. But here I can show you some I show you two circles. These two different yellowish colored pencils are circled, but here if I ask a question which one is high in value or not, yes, we might select, but the easiest way here is just to have a black and white image of the same photo. So as you see, the upper one is more bright, so the whiteness is more there, and the lower one is less, so we can talk about the value here easily. And these black and white images are very useful in the dental composites or anterior composites. Here you see when we combine Munsel's color system with dental structures, hue means any color, but here it's A, B, C, or D. But generally, as you see the article from Jordi Manota and his friends, he defined there again more than 80% or almost 80% of teeth are in A shade. So we are lucky we are not talking about the other shades. So if we are talking A shade, so what could be the chroma of these A shades? So the number coming to adjacent to A are defining the chroma. So A4, A3 to A1, the chroma is going down. And it means that the pigment or the structure just giving the color just giving the chroma to A shade is decreasing from A4 to A1. So we can talk about that the A1 is high in chroma and A1 is less in chroma and A4 is high in chroma. We call it hyperchromatic or chromatic shade. But what happens when we talk about value? But this time A1 is high in value because it's more bright, it's more whitish, but A4 is less. So this time it's not it's not going high from A1 to A4. This time A1 is high, A4 is low in value. So it's indirectly proportional. With we can say chroma and value are indirectly proportional. It's very useful knowledge. And to define it or to show it better, maybe these black and white image can show us that enamel can show us the difference of A1 and A4 shade easily. And here you see the value is going down, the brightness is going down from A1 to A4. And one thing that I want to mention here, if we are talking about chroma, we shouldn't forget that dentin is the source that's giving the chroma to the composite restorations. But when we are talking about enamel, enamel is the source which is giving value. So if you are creating a composite restoration, especially in class 4, a big class 4 restorations, whenever we are building whenever we are layering the composites, we should keep in our minds that we are giving chroma to the restoration with layering dentin. So we cannot estimate the value by layering dentin. So what we do, we layer enamel over it, and we define the value by layering this enamel shade. And the third topic here is mamelon design. And what is mamelon design? Mamelon design is the dentin layer on incisal 1/3. So planning these lobes, dentin lobes in incisal 1/3 will give us the future design of the incisal part of restoration. So if we layer high levels of dentin here and a very less enamel, so the incisal part will be not that translucent. So if you want to increase the translucency, or if you want to give some if you want to increase the translucency, so we should keep our mind that we should place there some enamel more, or we should add some specific enamel shades like opalescent ones to incisal 1/3 to have an incisal halo or to have a translucency there. But if we keep them shorter, these dental lobes, then the incisal edge will be more translucent, or if we keep them just till the end of the incisal edge, so it will be more opaque. So planning the design of dentin in incisal 1/3 will define our restoration earlier than layering the enamel shade. So here you see an image, and just enhancing the image with a photo editing program, we can find out that the translucency is located mostly in incisal 1/3 and proximal of the tooth structure. Here you see another image, and by again enhancing it, and in this image we can see the translucent areas are on incisal 1/3 and the proximal parts of the tooth. But what I want to mention here is the translucency. The term translucent is the term between opaque and it's not opaque, it's not transparent, but it's translucent. It allows the passage of light, but when we talk about opaque, it's not allowing the passage of light. But when we are talking about transparent, it's like glass fully allowing the light transmission. So translucency can be any degree. It could be something like an opaque or something like a transparent, very close to transparent one, but we can have different translucencies in different patients or different parts of the tooth, but mostly enamel incisal 1/3 are more translucent, that we can say. And there are some difference between the young and old tooth or old patients. Mostly the biggest difference is the thickness of enamel. Because of its thickness, it is high in value, and maybe because of the texture also. But what happens when the tooth is getting old? The thickness of enamel is reduced, so it allows us to visualize the dentin, and this dentin is more sclerotic, and it allows us to visualize deeper parts. So because of the hyperchromatic dentin after age, and because of the less thickness of enamel, it looks hyperchromatic, and less in value. And also we can use photo editing programs to visualize the difference, and we can see incisal 1/3 in means of translucency, especially in young patients, easily, and we can guess the placement of these dentin lobes better in these photographs. What I do here, I increase saturation and decrease brightness to visualize the incisal 1/3 how can I say, incisal 1/3 property of the incisal halo. I mean, here you see a natural tooth and then composite tooth, and the difference is here we cannot mimic enamel thickness in composite ones, because if we try to increase the thickness of enamel, it won't let us to visualize the chroma coming from dentin. So it's not always to mimic the nature. This slide is from Jordi Manavata, from his book Layers, and it's just to define that the thickness is the thickness, especially in middle 1/3 of tooth anterior composite restorations, should be kept around 0.5 or maybe a little bit more. And I would like to show you a diagram showing what happens when we have a fractured tooth and how we can make a restoration. We mainly love that the palatal shell is very useful, which we can have from silicone index, or we get a silicone index, sure, from a wax up or a mock-up. And then we layer a palatal shell, and this palatal shell is very thin, almost 0.3 millimeter in thickness, and over it we layer opaque dentin and dentin, but some dentin shades of some companies are enough opaque, or we do not use to have an opaque dentin underneath dentin. But anyway, if we need to increase the opacity of dentin, we apply this opaque layer under it, and then what we do, we add an enamel layer over these dentin. So here you see a close-up image showing the layers here, and palatal shell. Let me show you. Here you see 0.3 millimeters palatal shell, and then over it I layer an opaque dentin, and then just leaving a space here 0.5 millimeters enamel dentin and layering my dentin. This incisal 1/3 anatomy, incisal 1/3 translucency is achieved by layering these dentin lobes. So these hypersaturated and low bright photos will show us the placement of natural mamelons there. So we place our composite dentin as we see from the photographs. So I will show you another photograph. Here you see sagittal plan that I've written here some points. Okay, sorry. Yes, this is the opaque dentin, but in some composites we do not have we do not need to use opaque dentin because they are enough in opacity. But if we use these opaque dentin, I would like to show you that we can increase these triangle in area or in dimensions in 3D. So we can increase the opacity, but this E point is certain. So to keep a 0.5 millimeter in thickness enamel, we do not change this E point, but this B point, yes, it can be changed, but this is what we can do with the C point. If we need to layer more dentin, till the incisal edge. We just move this one to more incisal, or we just move it to coronally to have a more translucent area on the incisal 1/3. What else we can add here? We can use an opalescent composite shade to have more opalescence effect, opalescence structure on the final restoration. This could be the things that we can do to modify our plan. Here, another factor that's important while we are layering the enamel shades. What happens here, if we increase the thickness over than 0.5, as I showed you in the previous diagram, if we keep it 0.5, it's quite good. But what happens if we go 1 millimeter or 2, we cannot see the layer under it. So if we want to see A3 shade under our enamel, we won't be able to see A3, or we will see something completely different than A3. We won't have a chroma coming from under the enamel shade. So just to keep it less, not less, just something like 0.5 millimeters, especially in the middle 1/3 of tooth, is really essential to have a natural looking tooth structure. And other thing that we should be careful is, or we should have some knowledge about this, is the texture of the enamel shade. If our restoration is very glossy, it shows the chroma underneath, and if it's little bit textured, so we are not able to see we are not able to see the chroma coming from the dentin. So having a textured or having a glossy surface of enamel makes a difference to visualize the chroma underneath the enamel. So in the final steps of our restoration, if we find out our restoration is a little bit low in value, we should try to give some texture to the surface to increase the value. Or if we find it a little bit high in value, so we can make a more glossy surface or a texture to have an to make it visual, to make it seen. I mean, the chroma coming from dentin can be seen if we have this glossy texture, and we can decrease the value of the restoration. So you will see some clinical examples of mine, and here you see incisal 1/3 of my restoration, and this will result the final image in means of incisal halo, in means of translucency, because over these dentin will be completely layered with enamel. So what will happen after this? All the enamel shades will give some value and will give some translucency, and the thickness of the enamel will allow me to visualize the dentin underneath. So 3D, if we think bucco-palatinal thickness of these dentin lobes, if they are not enough to give a desired thickness for enamel, maybe because of a very thick enamel, we cannot be able to see these dentin lobes. If we overlayer these dentins, we will see finally chroma coming from the dentin, and it won't look natural. So just we are doing everything while we are doing while we are layering the dentin shade. This is another clinical example, and this is a different one because I didn't use a palatal shell here. I just layer my opaque dentin and then dentin, and having these 3 lobes, and just thinking in my mind that to layer this amount of enamel over these dentin will look will result a final restoration which will be similar to the adjacent one. But the palatal shell technique is more easier for to have a pre-estimated enamel layer. The last topic of these guidelines is effects, but these are really optional. We might see some white spots and cervical stains, but we may reproduce the white spots, but mostly we do not need to reproduce cervical stains, but these could be some effects, and we might see some horizontal lines, horizontal white lines or white clothings, but I just do a very small effect on my restorations, and these effects are not easy, and I must say them it's optional, so we keep it in the last place. So let's talk about shade selection. And here you'll see some. Here you'll see what I do, and to have correct shades in my clinic workflow, daily workflow. I use composite button try, and here you see some composite buttons. The rules are having a 1.5 millimeter thickness and need to polarize it perfectly, but need to be very fast. Prior to everything, I place these composite buttons and just polarize and get a very fast photo, because if we wait or if we are a little bit late, we won't have we won't have the correct shade, because there is a risk of losing water, losing teeth will be hydrated, so the chalky appearance of enamel will appear. So in order to have teeth hydrated, we should be very fast. Maybe it should be all done in less than 2 minutes, but the enamel thickness should be around 1.5. If we keep it less, so we won't get the correct shade. This is the result of the restoration. And here you see what I do. The middle line, the buttons are dentin, and they are placed as you see in the middle 1/3. So to define the chroma coming from dentin, the best place is the middle 1/3. And what I try here, increasing saturation and decreasing brightness, chroma can be easily seen, and the difference can be easily detected. So the correct shade is selected by this way in means of dentin. But when we are talking enamel, because mostly the incisal 1/3 is composed of enamel, so the image is turned into black and white, and the correct value and the correct shade is selected in this way. So the last thing that we do after we layer and we complete the layer and polarize our composites, we do finishing and polishing. And here you see we start with a rotary instrument, but sometimes, or I can say, I sometimes use these rotary instruments, but because we cannot control the strength of these instruments, we can we can lose the place of the line angles, and we can have some. We can narrow the size of the tooth, or we can remove some incisal angles of the tooth composite restoration. So it's better to use a abrasive strip instead of these rotary instruments. And the thing that I do to have a texture, I use 75 micron grease size diamond coated burr, which will have some, which will form here some texture. But it's why I'm using this blue band 75 micron grid size diamond coated burr, because it's easy to remove these scratch. The green or the black ones are not that easy. And then after this, to remove the scratch coming from the burr, I use brownies that we were using in amalgam restorations, or some hard rubbers like Schoeffer Van Gloss with abundant water spray, and it's around 10,000 RPM to have to smooth this scratch coming from the burr. And then I start my polishing with the diamond polish with the goat hair disc. And here you see the order from start with 3 micron to finish with 1 micron. But in my clinic, in my daily workflow, I just use 1 micron diamond polish, and it even works with the goat hair. And you see later, right after goat hair disc, I use a felt disc, which is the perfect thing to have a glossy surface. And use it. Normally, they recommend us to use aluminum oxide, but I use again diamond polish for it. We can even use that one. But if we are something like 1000 RPM, yes, we can use it without water. But whenever the speed is high, we should use abundant water spray to not to have heat on the tooth structure. You see the final image after this finishing and polishing process. Here you will see some clinical examples of anterior composite restorations. Upper left one, a fractured tooth, a very young patient. And here you see what I have after composite button try. After it's very, we should be very quick, and it shouldn't be more than 2 minutes to have this photograph. But these photographs are not that enough to evaluate the correct shades. So what we should use to evaluate the dentin and enamel shades, again, as you see here, increasing the contrast and decreasing the brightness. So this effect will give us ideas about the dentin, not the enamel, because in this way we can select the correct shade. Here I've selected A1 from Genial, but why not A2? Because this patient is young, and if you change the contrast, if you increase the contrast, you'll see some areas which are close to A1 shade, not A2. And that's the reason that I selected A1 shade. And here you see black and white image to visualize the value, to select the correct enamel shade. I used black and white image, and here you see A1 is more similar to value of the adjacent tooth. So and even the patient is very young in age, so it's called junior enamel. So that's why I've selected this shade. So what happens after this selection? This is the isolation photo. The rubber dam is inversed to have less blood or any fluid coming from the gingival area. And then preparation. And here you see a bevel, which is half chamfer. And then to protect the adjacent tooth from etching and adhesive materials, a Teflon tape is used, and I just layer opaque A2 over it to have an opacity here to block out the margin, to block out a grayish line here. If our dentin is not that opaque. If we know that earlier, so adding this opaque layer underneath the dentin will immediately stop this gray line, which is a real problem for most of us in our clinical workflows. And so I layered opaque dentin, and over this opaque layer, I layered my dentin. So here you see again these 3 lobes of dentin, some scratch made by a probe or LM fissura, and then I used translucent enamel to give more translucent area incisally, and add some white tints incisally to have a natural appearance. And then I layered my enamel. So what happened here? Layering enamel correctly will make the finishing process easily, and I won't have difficulties to keep these transitional lines, because if I do not layer them correctly, if these are not these areas are not created with enamel, so I will never have a transition line like this in my restoration. And here you see after polishing, and here you see the restoration after rubber dam removal. So single flash photo showing me a good marginal integration with some transitional lines, and the ridges here, and the grooves are easily seen with the single photo. This is another case, a very young patient again, something like 16 years in age, and here you see a close-up image. And I want to point out here that there is a need of translucent and opalescent area here. And here you'll see photos showing there is a need to create facial lines. And here you see the composite button try again. But this time this case is done with a new material. One of maybe second case with essentia. And I know that with essentia there is no need for opaque layer under dentin. So that I know that the opacity of essentia is enough to block out this grayish line and not to cause any gray restoration over it. So I know that it will be enough. But I layered this composite restoration with just 2 dentin masks, maybe, and additionally 1 opalescent layer. And in essentia, there are mainly 3 dentin shades. One is dark, medium, and light dentin. So as you see with this hyper contrast and decreased brightness photo, it's so easily to select the correct shade, because none of them, just only medium is the correct shade here. And what happens when I do select the enamel shade? I just have 2 chances, because these are the only 5 shades of essentia. So it's easy to select the correct shade. And here you see, because of the patient is young and it looks more better with light enamel, so I used medium dentin and light enamel. So you will see what will happen after layering. You will see a composite mock-up. Just use the medium dentin and light enamel. And patient loved the result, but I told him that I will have a silicone index from it. And then this is the photo of silicone index. And just having the palatal reference from the temporary restoration. In fact, it's not a temporary restoration. I just layered it without any etching and bonding procedure. And otherwise, it's not easy to remove without giving harm to the structure. and then have an isolation, and here you see it looks like even a final restoration, but it's not. I removed the mock-up material, and this is my preparation, and then etching and light palatal shell. Again, I played again. I used light enamel to have palatal shell, and then layered my dentin. You see my dentin lobes, but as we know, prior to our restoration, the translucency, there was a need of translucency and even opalescence there. So I layered my opalescent modifier from Essentia to increase the opalescence here, and to increase also the translucency. And here you see after enamel layering, light enamel, and this is the copy paste of upper right one, and showing that I need a minimal reduction to have the correct outlines. And then start these finishing, and then this is the final image. So need to little bit careful about the correct texture. The patient came 1 week later, and this is the 1 week recall of the case, showing correct line angles, showing good incisal halo, showing opalescence there, and it was fair enough for me and for the patient. And this is a case referred from a pediatric dentist of mine, and she immediately reattached this fractured part and just made a temporary restoration on upper left one. You see palatal view, and then again these 5 shades of essentia, 3 dentin in middle 1/3 and 2 enamel in incisal 1/3, and increasing contrast shows me that I should not use dark dentin. It's very obvious, and light dentin, yes, it's again I should use medium dentin. And then what happens if I turn the image into black and white? Just easy to understand, this light enamel should be used there. So if you have less shades, so it's easier to select the correct ones. Here you see what happens after light enamel palatal shell. So I had made a preparation here, and my plan is just to fill this area with a huge volume of dentin because the tooth is opaque, and even I need to reproduce a whitish area on mesially in incisal edge. So this is what happens after the huge dentin layer and whitish area with the white intensive of GC. Here you see enamel layer with light enamel, and then I'll start my finishing, and then this is the image, final image in the same day, showing that I made something similar translucency on the incisal area, and there's no grayish line, or the translucency seems normal. This is a single flash photo that my aim was to create some rifts and grooves here and showing some texture on photos. And you will see here another photo showing from incisal edge. These rifts and grooves are easily seen, and this is 1 week recall. And here you see a little bit close up. The chroma and value looks nice, and there is no grayish line, and I think it's fine. But this is 1 month recall of the same patient. It's even better. the recessed gingiva because of the rubber dam is the problem they are solved, and good proximal integration of two central incisors. And this is another image showing the texture is still there, because I was really curious about, I was really careful about keeping the texture till the end of the polishing process. Even after 1 month, the texture is there. And this is the final case that I want to present you today, is with essentia again. The patient has some complaints about the marginal discolorization, but in fact, these angled photos shows some all problems better. So I will show you what I've done here. First, removal of the old restoration carefully, not to remove some extra tooth structure, and then acid etching and washing with water spray, and you see the edge surface, and micro brush is just applied, and just showing you here one bristle of micro brush after curing the adhesive material, after curing the bonding material, sorry. And then a little piece of light enamel is placed there, and with an instrument it can be, we can create a smooth surface, but you will see what will happen. This surface is not good enough to have easy finishing and polishing. So I applied, I used a probe, but or I may use an LM fissura here to make surface more flat. But I used, instead of this, this time I used a sable brush from, I used this time again a sable brush from GC, the largest brush, and just to have a texture like that, just immediately cured after I remove, I left my brush on the surface, left my brush from the surface, and I used a heavy rubber, or I may use a brownie or chauffe Van gloss on the surface with abundant water spray, and had that texture like that, but it was not that glossy like upper right one. So what I did here is I used an diamond polish of GC, but this time I used a different instrument, but the speed was very low, just to keep the texture on the surface, and this tiny amount of polish material is enough to have this polish, but the polish is not enough if we work hard with the goat hair or this pink brush. So we need to improve it with a felt disc. Here you see what happens after the felt disc. It's really glossy, and the glossiness is similar to the upper right one, as you see here. And this is the final image after rubber dam removal, and you will see here the difference. You will see here before and after photo. I could have this case with a frontal view image, but it wouldn't show the difference of the surface glossiness or surface texture created by the instruments, with the rotary instruments. So that's why I prefer to have an angled view for this restoration. So this is the end of the visual part, but you may please ask your questions. Thanks for your watching. Yes, you may not use bouncers for the composite restorations or anterior region, but whenever you need to increase whenever you need to soften the flash, or if you want to decrease the amount of the light reflecting from the tooth structure, or if you want to have more smooth surface with your photography, then bouncers are really nice. Which camera should be used? I'm using a very basic DSLR camera. Any camera, but with a macro lens should be the correct answer, and a good illumination here. If you're asking your question about bonding bond, pardon me, certain. My protocol is just to obey the product manual. So just to apply the protocol that's given with the company, and I believe that anyone will work if they are, if you know, in the market. But the best thing that we should do is isolation, and we should keep the times, and we should be careful about the procedure on behalf of the dentin. And if your question about the things changing about hue chroma to composite restorations, yes, not only tooth structure but the composite materials are aging. So I believe that the current materials from all companies can stand these problems more than 5 or 7 years, maybe more than 10. What happens? We do not need to increase the thickness less than 0.5. The best thing is to have a less value enamel, because the design of the value is given with enamel. So whenever we decrease the thickness less than 0.5, we will have other problems, the chroma coming from the dentin, so it wouldn't look natural. Same question, sorry. How I do evaluate the correct thickness? As you have seen, I showed a diagram. So the thickness of enamel is certain in some points of the restorations till the incisal of the till the incisal 1/3 of the restoration. So there are some instruments like LM Misero, but you do not have to use them always. Just to be careful about the thickness, just to evaluate the thickness of dentin by having a mirror, just hand mirror, just using a mirror from the, just having some image from occlusal. Just we could use occlusal image to evaluate the thickness of enamel dentin. If it's the way that I do, but you will get used to it if you use these occlusal photos. What program I use with to evaluate these photos? I was using Picasso from Google, you can find Picasso 3. It's a shareware program. It's nice to use it, or you can use PowerPoint or Keynote also. How can we catch the right chroma in some clean? The easiest thing to catch the right chroma is to increase the saturation and decrease the brightness, and having an image with composite buttons. It's really working. It's always working. And what should be the thickness of opaquer? It depends on the opacity of your opaque dentin, but you should get used to your composite, this opaque material to have the correct thickness. Do you recommend? Yes, wetting agent. These are not wetting agents. Especially what I use here is a composite primer. It's not the primer of the bonding. It's not the composite. It's composite primer from GC, but it's not the primer of etch and rinse systems. It's something different. It's just only resin, and I just wet my brush. And if it's that wet, it will not work that better. So just a little bit, I just remove the excess material over my brush, on my brush. Sorry. What? Okay, what do you do for hiding the differentiation line between, you mean the marking, the line, the grayish line in between composite and tooth structure? Yes, because it appears because there is the result structure will be less in opacity than the natural one. So if we can keep the opacity similar to the original tooth structure, there will be no grayish line or a gray structure. So we should be sure about the gray. We should be sure about the opacity of the dentin that we are using. If our dentin is not that opaque, so we should use an opaque layer on it, under it, or if we layer an enamel shade which is more than 0.5 in middle 1/3, it will result a grayish line there. If the patient has a discolored margin of the old restoration, what I do, because I have some old restorations and the patients come to me and because of some marginal problems, I just remove them with very soft rubber, and maybe it works. But if it doesn't work, I need to remove these problem areas and then relayer the enamel there again, or maybe I need to remove all the restoration, but generally just removing some margins there would work. You're asking me how many hours I'm spending for the case. Yes, maybe 2 years before I was spending lots of time, but now it's easier to finish these restorations. Yes, 4 hours is really long time, but both patients and we can be very tired of it. So I just sometimes I do two tooth, I restore only two tooth and call the patient again, do the other restorations later. Did you, sorry, did not like to use rotary disc. With rotary discs, I do not use a paste with them, because pastes are generally used with polishing tools, not with finishing tools, because I use these rotary discs or rotary, I use these rotary discs just to finish the finish the restoration. And since enamel wears of time, should be modified. No. If the enamel wears of time, should we modify the thickness layer of enamel dentin with the age of time? No, because whenever I place enamel shade over dentin, I always try to keep it around 0.5. I change the chroma of the restoration by changing the dentin underneath the enamel. And if I need to reduce the value, if I need to have a low value restoration, I use a low value enamel shade. I think this is the final question. So any more questions? Yes, sir. Okay. Using light cure calcium hydroxide paste, I do not use this calcium hydroxide paste, sorry, but it should be very thin, so why I don't think that it will change the opacity of or change the light properties of the restoration. So thank you for watching my webinar, and I would like to thank you all, and thank you all my friends all around the world.
Thank you very much, Dr. Köken, for sharing your lecture and your insightful information with us. We'd also like to thank DT Study Club for making this online course possible, and thank you, our wonderful audience, for your interest and participation. The CE quiz is now available online on the course page, and completing it will allow you to earn your ADA CERP CE credits. The recording will be posted online within the next 48 hours. You receive an email notification with a link to the recording. Further questions for Dr. Köken may be submitted directly on the website on the courses page under the Ask the Expert tab. So please go ahead and submit your questions, and Dr. Köken will be sure to get back to you as soon as possible. Please be sure to visit the DT Study Club educational platform, www.dtstudyclub.com, and keep an eye out for a growing schedule of online courses. Thank you again to all, take care, and goodbye.